Yes, very fine assistant nurse today. I'm Dr. Paul Collins. This is Reba. Reba's going to be a breeding female, so she's having her hips checked by two different methods, but we have to put her under anaesthesia for this to happen. So we placed an intravenous catheter and we induce the animal with a liquid anaesthetic, and then we'll swap her over onto the gaseous anaesthetic once we've done that and place the endotracheal tube. So Reba's been induced with the vaccine induction as we showed before. She'd been hooked up to a gaseous anaesthetic machine. We use isoflurane in this practice. It's the safest anaesthetic that we have gaseous wise. We've got monitors running. We're measuring her blood oxygen gases as well as her heart rate as well as her respiratory rate. And now onto the x-rays. So we're taking two different types of x-rays today. The first is for the Kennel Club hip and elbow scoring. So we have to take what's called a ventrodorsal extended hip view. So the dog is placed on its back. The word ventrodorsal just means bottom to top. And what we have to do is just stretch out its legs and get its knees straight and slightly turned in. And we take the shot straight down through the middle of the pelvis. This gives us an idea of the actual structure of the hip itself, and whether the hip is structurally functional and the ball and socket are actually in place. It also gives us an idea about whether there's any evidence of degeneration in the joint. So George is about to take the x-ray, so that'll be the beep. And that's also the first shot that we'll take in a series of 3 for a PenHIP. So this is now an extension of the hip screening technique called the PenHIP scheming. The reason we do this is we're looking for evidence of hip dysplasia, and the definition of hip dysplasia is hip laxity, meaning how loose the hips actually are. So the first view that we took just now is just to assess the structure of the joint, whether the ball and socket is well established. This actually assesses, or this technique actually assesses how loose the joints are. So the first or the second shot for the PenHIP, the first of the type of PenHIP x-rays, is called the compression view. So what we have to do is again focus over the hips, is get the legs up and straight, and actually bend the legs in to push the hip ball into the socket as far as it'll go. So Georgie, whenever you're ready, take that x-ray. And then we'll progress on and we'll do the distraction x-ray next. So now we're going to take the distraction view. Jess is holding a distractor. This is specifically made by the PenHIP University program. It's got my own number in it, so that it's basically as many fail-safes to avoid manipulation of the x-rays to make hips look better than they are. The hip bars have to be focused right over the hip joint. And I then take the legs, raise them up, and I squeeze into the bar. This levers the hips out of the joints and therefore shows us how loose the hips are. And as we said before, hip dysplasia is defined as the laxity in the hips and the looseness of the hips. So if Jess just wants to push down a little bit further away, I'll push in. And take the x-ray now, please. And that's the distraction shot. So the difference between the compression shot and the distraction shot is determined by a specialist radiologist at PenHIP itself, and that gives us what's called a distraction index, which is the degree that the hip luxates or subluxates. And the higher the number, the looser the hips, so the more likely the dog is going to have problems with its hips. So for a breeding point of view, we want to have nice low numbers. Therefore we're improving the breeding of the hips, but also from a pet perspective, if you have a dog that's suspected of having hip dysplasia, this can be used from 16 weeks of age onwards, this technique, and it will give us a reliable indicator, and that is the only reliable indicator and predictor for hip dysplasia in dogs that we have available at the moment. So all through these videos we've been talking about hips and hip dysplasia, and that's what a lot of people focus on. One thing that's really important is also looking at elbow dysplasia changes. Elbow dysplasia is actually in some ways more severe for a dog because the dog carries a lot of its weight on its front legs. So if it has a problem in its elbow, then that creates a real big problem because of the amount of weight bearing on them. So again, because this is a breeding dog, we're doing an elbow screen. That'll be analysed by a specialist radiologist and given a score. And the breeder, if we have evidence of elbow dysplasia, would elect not to breed with this girl. So the way we do it is we take a lateral elbow flex shot. So that's ready to take whenever you like. And we do that for both sides, and again, so that goes along with the hip X-ray, and that is sent away to a specialist radiologist for scoring, and the PenHIP series is sent away to Pennsylvania University in the US, and that gets us a distraction index. And that's how we screen dogs for hip and elbow dysplasia. Okay, and now Reba's had her procedure done. She's just in recovery. Our nurses sit with our anaesthetic patients right until they're fully recovered, just to make sure that there's no problems. She's just about awake now, so she's coming around nicely.